So, what actually is PuraStat itself? So let's talk about actually what's inside the syringe first. So PuraStat is a synthetic peptide hydrogel, and it's conformed and made up of three main characteristics or ingredients as such. So it is the three A's that I call them. It's alanine, arginine, and aspartic acid. It's comprised of the three A's that are naturally found within the human body itself. And what they do is they form a, say, multi-layered matrix, hence the name 3D matrix. And what that actually does is once it is applied to the lesion area or the bleed site that we have, those three ingredients are then come in contact with positive ions. They lock in together, and that forms our 3D barrier, our matrix, our mechanical barrier, which is a multi-layered barrier, and it works on a nano level. So once this is applied to the lesion area itself and it comes into contact with those positive ions, it supercharges the liquid formula, the hydrogel. They lock in together in regards to that 3D matrix mechanical barrier, and that is going to stay in place on the sites that we've applied for up to 6 days. So it's going to act as that mechanical barrier for 6 days, but it will stay present in the patient for around 28 days. So we do actually give patient implant cards within the boxes that you receive, and you can give these to the patients should you wish, just because it takes that little bit of time to break down. Your body does not see it as a foreign object or a foreign body, so it doesn't try to flush it out as quickly as it can. It's left to stay in place so it can cover and help kind of protect the wound itself, stop or help slow down any kind of delayed bleed risks, anything like that. Once we have applied the PuraStat hydrogel onto our target areas, what you will find is it will lock in and form that 3D matrix, that barrier, over the site that we've applied it on. It will stay present there as a mechanical barrier for around 6 days, and it does stay present within the patient for up to 28 days. Now, it is officially a Class C medical device because it's an implant. It's not a pharmaceutical. So we do have patient cards here that you can give the patients for their kind of information and their learning on the product. But this will be reabsorbed by the body within around 28 days. So that's one key thing just to watch out for. So in regards to PuraStat and how it, say, comes delivered to yourselves, we've got the various sizes here in front of me. So we have both 3 and 5 ml sizes available, and they come in boxes like so. They are individually packaged, so within each box there is one single-use syringe. It's not multi-use, so it is one per use. And they also come with their own endoscopic specific catheters, but they are purchased as a separate. So if you buy, say, one of the syringes here, please do make sure you also purchase the catheters. They come in units of 5. So now what I'm going to show you is how, say, PuraStat would arrive to yourselves in the units. Talk about how kind of we set it up, which is nice and quick and nice and easy. Now, one thing to remember, and it is key for PuraStat, is it is a fridge product. So please do keep these in the fridge. Now, they can be out of the fridge for up to 12 hours as a maximum. So again, as a quick tip, it's very easy to have this out. If you've got a list that you might need this for or a particular procedure, it's quick and easy to have this out on the side, ready if needed for use. If it isn't used and within 12 hours, please do pop it back in the fridge so that it's ready for the next use. Now, if we open up the box here, just so you can see how it would arrive, you can see it's a single syringe, which is pre-packed. And then you have your IFUs and your products information cards, as well as then your patient stickers as well for your books. So we put those to one side for now. This is how a syringe comes like so. So again, it is individually packaged and wrapped, but then this is quick and easy to open. And as you can see here, we have the syringe. It does have this little cap on there. So what we're going to do is we're going to twist and unlock the cap. And then with your specific endoscopic catheter, what we're going to do is just put that in the end, lock in place, and we're now ready to use PuraStat in the working channel of the main scope and ready to apply this to a bleed. So now I want to talk more about the gel itself, and as we said previously, what's inside the syringe. So hopefully, as you can see here, this is a clear gel. So it's a transparent gel. I would normally say it's a bit like a window, as in you can see it's there, but it's obviously see-through. So again, it is transparent, which is great. Now, in regards to the gel itself, which I'll show you in a moment, it's fairly viscous. So again, it's quite a thick gel. It's not like water. It's not going to be runny. It's not going to be sliding everywhere. So it is a fairly viscous kind of texture. In regards to the catheter itself and say the priming setup of PuraStat, as mentioned previously, the pH balance of this is a pH of 2. Now, I know many of you will be used to priming accessories and lumens with, say, saline or things like that. With PuraStat, we would ask you not to prime with any other liquid, substance, or formula as such. The only thing we would ask you to do in terms of priming your catheter with PuraStat is prime it with PuraStat. So, as you can see, what I would do is I'll demonstrate how easy it is to set up. I'll pop the lid off there. I can attach it to our specific endoscopic catheter. And then from here, we would be ready to prime the catheter itself. And hopefully, as you can see, there's a see-through area just here at the end, so a clear area. And again, endoscopically, you will see this on the screen itself whilst we're applying it. But obviously, whilst we're outside the main endoscope, we can clearly see the liquid going through the lumen of the catheter and coming to the tip here. So in regards to priming, don't use any other modalities or formulas or anything like that. Please just use PuraStat to prime. If you find that you have still got PuraStat in the catheter and you want to use more, all we ask you to do is simply unlock the syringe, draw back to fill the syringe with air. We're going to reattach, and then we're ready to plunge and continue the application of PuraStat. It's really that quick, simple, and easy.